Hey, trying to fix a problem without fully understanding it, that can lead to a cycle of trial and error. That can cost time and money, all while not really fixing anything. Now, if that problem is chronic neck or back pain, fully understanding the source of that pain is critical. And Dr. Miller and his staff take the time to hear patients, look at the facts, and create customized treatment plans. Dr. Miller joins us this morning, and he's brought a guest, Gary, who has some firsthand knowledge of this process. You may recognize that face. Good morning, guys. Excuse me. You often hear this, right, Dr. Miller? I've tried everything else. that comes to your door quite often, right?
Absolutely, and you know, it's unfortunate because the people that come to our office are obviously in a lot of pain with their neck or lower back, but it's really robbing them of their freedom to live the life that they want to live. Many of them aren't able to work or do chores. They feel a burden to their family because they're lagging behind and can't, keep up with them in activities. And yeah, the treatments that are out there often revolve around symptom relief and just temporarily masking that pain. And the condition persists, and they just keep struggling. And many of them have side effects as well that they're concerned with, and don't necessarily want to proceed with that.
One of those side effects. We talk a lot about the physical pain and the symptoms that people feel, but there's a mental aspect to this too, because it's got to feel just frustrated, almost hopeless, like where you've tried so much, where you're just like, well, nothing's ever going to work.
Yeah, and it's just temporary relief many times, whether it's, different medications, physical therapy to maybe work on surrounding structures, but not actually fixing the problem. And then, oftentimes it leads to things like injections at pain clinics or even neck or back surgery. And, it's just the fact when you're not fixing the problem, you're doing things to decrease the pain only. The condition will continue on, and yeah, there really is never an end in sight if you take that approach.
Yeah, that's got to feel very frustrating. Gary, you may have been there too. Let's introduce Gary. Gary, we met months ago,
yes, we did.
and we found that you had found relief from this symptom. Refresh our viewers' memories. What was happening with? I mean, you were laying on the floor.
Yes, I was. I was there for about a month. It was a tough time in my life, but we've gotten through that. Things are really going good now. I've retired since.
Well, you were, and that's, if I remember right, something that we were looking forward to. Like you were getting close to retirement,
right,
but you didn't know if you were going to be able to and what was going on. Before things got better, refresh our memories on the things that were happening to you that weren't so great.
I was having difficulties moving my leg. I had a lot of numbness and a lot of extreme pain in the lower portion of my back, and I worked every day of it. Didn't help, but I was getting to the last part of my life there, and we got through her. The pain was really great. I ended up calling Total Health Chiropractic.
Mm-hmm.
I saw these programs on television.
That's you on the floor.
Yes, it is.
So this is you not even able to get up off the floor.
That's
because
right.
The pain is so great.
I could only get up for like 15, 20 seconds, and the pain was. I've had a lot of pain, and it was bad.
So
I had to get back down.
When you came into Dr. Miller's office, obviously, as I mentioned at the top of this segment, that did you feel listened to? Did you feel like you were
Yes.
actually getting to the solution of
Yes.
the problem?
Yes, it was a very comfortable conversation we had. He took the time and he showed us what the problems were, that I was still a candidate for this program. I didn't wait too long.
Mm-hmm.
That's part of the problems if you wait
too long.
long.
Yeah.
So it's turned out really great.
What did you see, Dr. Miller?
Well, I mean, first of all, because he couldn't really stand or be upright, he had to be carried down to my office, assisted with his son and I think his wife.
Right,
and
well,
he had to lie on the floor. I had to get down on the floor with him to ask him questions about what was going on.
Right.
But as we started figuring out what was wrong, we got some x-rays, and he had a lot of stenosis in his lower back, arthritis, but also severely degenerated discs down there that were encroaching on the nerves. And he was a great candidate for our DRX 9000 program, which helps regenerate these discs.
And how does it do that?
Well, through the aid of computers, Todd, it stretches that specific area of the spine, tricking the muscles in the area to relax so that they're not fighting against it.
Okay.
And when you can stretch it the way this does, it actually draws moisture and nutrients back into those discs. So like a dried sponge that gets wet again, it can thicken up in height and create space for the nerves, but also be more of a shock absorber. So when you do those daily activities and move around, it absorbs the shock instead of jarring that spine and irritating the nerves. And so in this sense, when you fix that disc, you help with pain, and they're able to function again freely because, you know, we're fixing the source of that pain. We're not just temporarily masking that.
And that's that temporary word that you use. Gary, this is a great opportunity for us to show folks that this isn't something that you're going to have to go back and do again and again and again. This is 7 months afterwards, and how are you feeling today?
I feel great. I mean, I'm waiting for the spring and summer so I can do a lot of the things that I haven't been able to do. We're just waiting.
You're chomping at the bit, aren't you?
I am. I am chomping
Look
at
at
the
these
bit.
great pictures of you up and about, feeling strong again.
And you know, that was like 3-4 weeks afterwards.
Wow,
That was
only
the beginning.
less than a month after.
And you know, I mean, this is like you said, 7 months later, feeling really good.
Good.
I tell a lot of people about this because it works. It really does
You're
work.
doing that right now.
And I knew that it would work. That's why I wanted to come after I retired. I just didn't make it.
All right, Dr. Miller, let's get someone else on that machine as well, because I'm sure there's somebody watching that could use this.
Yeah, please don't wait to the bitter end. You know, there is hope for you. If you call our office today, we have a nice special for $52. We'll do a consultation, a physical examination of their spine, and also they'll get a free session on our hydro massage bed to start relaxing and loosening up a little bit. You know, and we just want to help and get to the source of their problem and make sure they're a good candidate for this as well.
Yeah, if you're having trouble functioning independently, maybe you feel like a burden to your family, or just hoping that the pain goes away on its own, well, none of those things have to happen. You can call that number on your screen, 828-0861. Get more info at thchiro.com. Gary, great to see you again. Thanks for being here.
Thank you, Todd.
Dr. Miller as well. Thank you so much. Don't forget that new patient special waiting for you. Coming up.